Welcome back, folks. Most Americans likely have at least one high risk factor for COVID-19 and flu, but many don't know that they have a greater chance of developing severe illness if they are infected with either of those viruses. Joining us right now with more insight is Dr. Amesh Adalja, senior scholar at the Johns Hopkins Center for Health Security. Doctor, thank you so much for joining us. First off, who is considered to be at high risk of more serious illness or hospitalizations from flu or COVID-19?
So that's anybody that's in the extremes of age, very young, very old, pregnant women, people who are immunocompromised, those with heart and lung disease. It's a large swath of the population. Diabetics, obese patients, anybody that has any medical condition or is pregnant is really at high risk for complications.
Okay, and now can you tell me what are antiviral treatments out there and how do they work and really who can get them?
So antiviral treatments are medications that you take that interfere with the virus's ability to cause damage. And we've got antivirals for flu and for COVID. So for influenza, drugs like Tamiflu or oseltamivir or baloxavir are available. And for COVID, we have drugs like Paxlovid. We have drugs like molnupiravir that are able to decrease your chances of developing complications, decrease your rate of hospitalizations. And any high-risk person really benefits from them, but they need to make sure that they know that they're around, and they need to be proactive with talking to their provider about whether they might qualify for an antiviral.
Exactly. And now these are prescription medications, and studies show that they are highly effective. Now, are they being prescribed as often as they should be, in your opinion?
They are not. They're highly underutilized for both influenza and for COVID. And this is a real problem because we've got these great tools that science and medicine have developed, but they sit on shelves and don't help as many people as they could. And that leads to people coming to the emergency department, people getting hospitalized and bad outcomes. So what we need to do is increase awareness, not only among providers, but also among the general public, that these antivirals exist and that they should be something that people ask for if they meet the criteria for.
Now, what do you think might be keeping doctors and other healthcare professionals from prescribing antivirals to their patients?
I think there's lack of awareness. People don't quite understand, and that includes providers, of how they work and who benefits from them. That people may be overly wedded to like a time window that they think they need to, it's too late to get them, and they might be misapplying some of the data for when these things were approved, and when they're most effective, when they're less effective, and when they're not effective. And I think people don't actually recognize when their patient might be high risk. They don't think about things like obesity, or they don't think about pregnancy, or they may say the patient looks too good in front of me right now, so I don't think they'll benefit from an antiviral. So there's a lot of misconceptions about antivirals that are sort of diminishing their use and their impact.
Exactly. I know you touched on it a little bit, but how can we ensure that people are aware of and have the access available to the antiviral treatments, especially during the respiratory illness season that we're in?
So there are lots of resources from public health agencies, from the CDC, but it's really just making sure that people understand that there are organizations out there that are promoting antivirals, that there's resources on the internet that they can look up to see which antivirals are available. But I also think it's just thinking about the way they think, about antibiotics. When someone has a cough, they always ask for an antibiotic. They should think, I have a virus. Should I be getting an antiviral?
Exactly. And I know you touched on it, but what are some of those resources that people can look out for to go to for additional information?
So the Centers for Disease Control has a lot of pages for the public on influenza and COVID antivirals. Some of the drug manufacturers have those things as well. There are professional organizations like the AMA, the American Academy of Pediatrics. All of them have places where you can look on the internet and find some data about these antivirals.
Oh, yeah. Thank you so much for joining us this morning, Doctor. Such great information for folks, especially since we're still in the thick of this sick season.
Thanks for having me.